A deadly virus outbreak on a cruise ship, multiple deaths, international quarantines, and fears online asking the same question. Is this the next COVID? But infectious disease experts say the answer is no. So what exactly is hantavirus? Why are health officials still taking it seriously? And what makes this outbreak different from the early days of COVID-19? Let's break it down. What is hantavirus? Hantavirus is a rare but potentially deadly virus, usually spread through contact with infected rodents, especially their urine, saliva, or droppings. In severe cases, it can cause serious lung and breathing problems known as hantavirus pulmonary syndrome. Symptoms often begin like the flu: fever, fatigue, muscle aches, headaches, but in some patients, it rapidly progresses into respiratory failure. Certain strains have fatality rates as high as 30 to 40%. The cruise ship outbreak. Global concern intensified after a suspected outbreak aboard the cruise ship MV Hantavirus. So far, multiple passengers have died, others tested positive, and countries around the world began monitoring exposed travelers. The outbreak involved the Andes strain of hantavirus, the only known strain capable of limited human-to-human transmission. That immediately triggered comparisons to COVID-19. But experts say the similarities mostly stop there. Why experts say it's not like COVID? According to infectious disease specialists interviewed by CBS News, hantavirus behaves very differently from COVID-19. COVID spreads extremely easily through the air. Hantavirus does not. Experts say human-to-human transmission of the Andes strain is rare and generally requires prolonged, close contact, such as sharing a cabin or caring for an infected person. That makes widespread global transmission much less likely. One expert compared COVID to a wildfire and hantavirus to a smoldering wet log. Health officials also say hantavirus has a longer incubation period, giving authorities more time for tracing and containment. And unlike COVID, hantavirus outbreaks tend to remain small and localized. Why health officials are still concerned. Even though experts don't believe this will become another pandemic, they are still taking the outbreak extremely seriously. Why? Because hantavirus can be deadly. The current outbreak has already led to quarantines, international coordination, and monitoring across multiple countries. The World Health Organization warned that more cases may still emerge due to the virus's long incubation period. Experts are also concerned about misinformation spreading online, especially comparisons claiming this is COVID 2.0. Most infectious disease specialists strongly reject that idea. They say the overall risk to the public remains very low. Lessons from COVID. At the same time, many experts say the world learned important lessons from COVID-19. Rapid communication, transparency, surveillance, and international cooperation now play a much bigger role in outbreak response. That's why governments are acting aggressively, even though the outbreak is relatively small. Some experts argue it's better to overreact early than respond too late. Others worry that public trust in health institutions has weakened since the pandemic, making communication much harder. And that may become one of the biggest public health challenges moving forward. So, is hantavirus the next COVID? According to infectious disease experts, probably not. The virus spreads far less efficiently, requires much closer contact, and appears much easier to contain. But it is still a serious disease with a high fatality rate in severe cases. And the recent cruise ship outbreak is a reminder that global health threats can emerge anywhere, at any time. The key now is balancing awareness without panic. Subscribe for more global health news and medical updates explained clearly and responsibly. And let me know in the comments, do you think the world is better prepared for outbreaks now than it was before COVID?